Okay. Now, we talked about that. You need to know these codes. If y'all are taking notes, and you should be, guys, red ink and yellow paper. Why? Because red says, stop, and yellow says, ding, 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 pay attention. Our brains are already programmed. That's a neurological response, right? Get you some yellow paper and some red ink. You need to know that. It's going to be on your test. Okay? All right. Respiratory pharmacology. Oh, wait. I got a question for you. Sorry. If a patient that takes Coumadin asks you if they can have some ibuprofen for a headache, what should you tell them? Just a quick answer. What should you tell them? Why? Lady J. Because it's a what? What kind of drug is it? They should take Tylenol instead, right? They cannot have ibuprofen because it's an NSAID and it increases their risk of bleeding. So we'll give them some Tylenol, okay? I want you guys to know that the physicians will sometimes overlook that. So as the nurse, you have to catch it and be like, hey, this person's on Coumadin and they have ibuprofen here, okay? All right, respiratory drugs. The most important concept here is to rescue versus maintenance. If somebody is having an exacerbation of asthma, COPD, whatever it may be, we're going to do the rescue before maintenance, okay? A rescue inhaler is used when the patient is having an acute attack right now. Right now, in the moment, okay? A maintenance inhaler is what they use every day to prevent attacks, okay? Welcome in, Steph Marie. 7-11. My birthday's 7-11. Is that your birthday, Steph? The rescue inhaler. What is the rescue inhaler, you guys? What is used in an acute asthma attack? Anybody know the drug? Anybody? Albuterol. That's right. Hang on a minute. I hate this thing. TikTok be getting on my nerves trying to tell me I'm inactive. I'm not inactive. Sexy Mocha. Your comment got, let me go ahead and approve these. Y'all's comments are getting filtered out and I can't stop it. So I am approving them. And it won't tell me all the time. So if I did not see it, I'm sorry. Shorty, welcome in. All right. Albuterol is the rescue inhaler. Everybody drop albuterol in the chat. It is a short-acting beta-2 agonist, also known as a SABA. S-A-B-A. Empowered the Queen and Maya. Welcome in. A SABA. S-A-B-A. Okay? It works in 10 to 30 minutes. It opens the airways fast. The maintenance inhaler is a long-acting beta-2 agonist. It's known as a LABA. L-A-B-A. So, the way I remember these, SABA, S-A-B-A, short. Short S, SABA, that's your rescue. LABA, long, L-A-B-A. Long, that's your maintenance. Okay? Olivia, welcome in. Salmeterol, okay? That's a long-acting. Or an inhaled corticosteroid, okay? Or ICS like fluticasone. The NCLEX question is going to be such, like this. A patient is having an acute asthma attack. Which inhaler should you use first? It's the rescue inhaler every time. Or the SABA. SABA, S-A-B-A, rescue inhaler, short acting. You always want to rescue before you maintain. Got it? Drop a 1 in the chat if y'all got it. Everybody drop S-A-B-A in the chat. Acute asthma attack. SABA. S-A-B-A. All right. Inhaled corticosteroids. Fluticasone, budesonide, I can't say it. Beclomethasone. Okay. These reduce airway inflammation for long-term control. They are not rescue medications. Okay. The most important teaching point. Rinse your mouth after. Okay? You have to rinse your mouth after. All right? Why should you rinse your mouth? Because corticosteroids residue in the mouth causes what? What does it cause? Candida thrush. That's correct, Sexy Mocha. Thank you. Guys, if you're just coming in and you have not got your Daily Heart Me, please go get your Daily Heart Me. Tap the screen. We're at 48 shares. I want to try to get up to 100 shares. If you don't know how to share the live, hold your finger on my forehead and it'll pop up. Thanks for that follow, Sexy Mocha. And hit send to about 10 of your friends, okay? So your nurse friends can come and hang out with us. Lady J, Candida thrush is correct. It filtered your comment, but it showed me. Thank you for that repost, Sexy Mocha. All right, guys. Let's see. It's, and thrush is the white coating on the tongue and inside of the cheeks. The NCLEX will give you a patient who has been using their fluticasone inhaler and now has white patches in their mouth. The answer, they're not rinsing their mouth after use. Teach them to rinse their mouth. Thank you for sharing, Keisha. Teach them to rinse their mouth after every use. Teach them to spit, rinse, and all the stuff. Okay? And blessed Istanbul on your life. Oh, I'm so glad, Lady Bird. Welcome in, sugar. Lady Bird, since you're new, if you go to the LINK in my bio, there are free complimentary documents for this class. I highly recommend that you go get them. Also, my full comprehensive review and question bank is there. I do have it discounted right now. My students that are in here, you can ask them. I don't got to tell you. I highly recommend you getting it. You'll pass your exam if you come to this class and you get my review. You just got it? Thank you. I appreciate you. Oh, so what, you see that, huh? Oh, you're a mod. Okay, I got you, baby. Thank you. I've been emailing. I'm like, okay. All right. So they're not, if they got Candida, for all of you all that have purchased my book, thank you so much. I appreciate you. If they have a thrush, they're probably not rinsing their mouth. So you need to teach them. Remember what I said about teaching, right? I know my handwriting sucks. I'll get better, I promise. Drug action, side effect, nursing implication, and patient teaching. Okay? All right. If a patient uses both albuterol and fluticasone inhaler, which one goes first if they're using their albuterol and the fluticasone? Think about it. All right. The bronchodilator, it opens the airways, right? And the corticosteroid can get in deeper. Okay? So you do the bronchodilator first and then the corticosteroid. You wait 1 to 2 minutes between inhalers. Bronchodilators before corticosteroids. Rescue before maintenance, always. Okay? Theophylline. This is an older drug, but the NCLEX still likes to test on it. It is a bronchodilator with a very narrow therapeutic index. Queen Knight, welcome in. The therapeutic level is 10 to 20 micrograms per milliliter. Theophylline, 10 to 20 micrograms per milliliter. Toxicity signs, nausea, vomiting, tachycardia, tremors, and at high levels, seizure and arrhythmias. Caffeine increases theophylline levels. Teach patients to limit. That's correct, Lady J. Teach patients to limit caffeine intake. Many drug interactions, okay? And monitor the level closely. So, the inhaler sequence, bronchodilator, aka albuterol, then your corticosteroid, like your fluticasone, okay? Rinse the mouth after the steroid. Never use a LABA alone for asthma, always with an ICS, okay? Section 3 on your handout. Okay? Let's go to section 3 on today's handout. And guys, if you don't know today's handout, the date is by it. I've just started putting the date in there. Okay? And for all of you all that don't know, for my students, that today is a student request class. So I did not come up with the topic. I have taught all of my lecture for this class, but I give You know, it goes 14 days, and it can go on and on, really. But in 14 days, I can teach you everything you need to know. But this is a student request class. Chris requested this class. So you guys have the ability to request what content that you want me to go over. And if you purchase I shouldn't say if you get my book, but I respond to my DMs. I respond to all of your DMs. Okay? That's not an auto response. It's really me. All right. We got section 3. Loop. All right. Equals. Loses. K. Thiazide. I gotta make sure I'm spelling it right. I spell everything wrong. I told y'all I'm dyslexic. Loses K. And I put an extra O in there because I don't know how to spell either. All right. Loses K. K. Sparing. Equals keeps potassium. Okay? So we got the loop diuretics, the thiazide, and the potassium sparing. So your loop diuretics waste potassium, your thiazide waste potassium, and then you have potassium sparing diuretics. Diuretics, we got 3 categories. There they are. Okay? The most important thing to know about loop and thiazide diuretics is they both waste potassium. They both waste potassium. Okay? Every time you give Lasix or hydrochloric thiazide, you are pulling potassium out of the body. Not just fluid, you're also pulling potassium. Okay? You monitor potassium levels. Tell the patients to eat potassium-rich foods like nanners. Apples and bananas, not apples, but nanners and oranges and taters and leafy greens. The Miseries, welcome in, love bug. We are going to monitor potassium levels, and we're going to tell our people to eat the bananas, the oranges, the taters, and the leafy greens. Okay? Or the provider may give them a potassium supplement, which would make life easier, right? Because people like me, I don't do the right thing all the time. I'd rather just put my patient on a potassium supplement. Lasix is the most common used loop diuretic. Flowers and Gardner, welcome in. Minnie, welcome in. Welcome in. KY, welcome in. The most commonly used loop diuretic is Lasix. It's powerful. It's fast. Okay? The NCLEX question that students miss the most. When do you teach a patient to take Lasix? In the morning, not at bedtime. Why? Why should they take their Lasix in the morning and not when they're getting ready to go to bed? Anybody? Do you want to pee all night long? Do you want to pee all night long? Carolyn B., welcome in. You need to tell them to take their Lasix in the AM, because if not, they are going to be up all night long peeing their britches off. Okay? It's true, Ladybird. They'll be up all night. Now, in the hospital, we can give them an old cooter canoe or a catheter, and they'll be good. Y'all know I call PureWicks a cooter canoe. I had a 90-year-old lady say, give me that there cooter canoe. I said, what? It took me a whole hour probably to figure out what the heck she was talking about. She said, you know that there tampon thing that you pee in while you're in the bed, you ain't got to be bothered. I said, well, heavens to Betsy. She got that cooter canoe. Well, they ain't got to. Y'all know what? They do make cooter canoes for at home now. You can get them on the AMAZON. But anywho, you don't want your patient up peeing all night long. And they might get up and be tired and have a fall or anything in the middle of the night. So take it in the morning. All right. The NCLEX might ask you a question like, the patient says they take their Lasix at nighttime. Is that right? No, it's not. Take it in the morning. Okay? In the morning. All right. Also, Lasix given IV at high doses could be ototoxic. it can cause hearing loss. So you want to make sure that you push it slow. IV Lasix, slow. Because ototoxicity. You shouldn't slam anything in unless it's something we're trying to save their life in the middle of a code. Okay? Everything I say low and slow. There's always something. Spirulindactone or aldactone is a potassium-sparing diuretic. This one works differently. It blocks aldosterone, which means the kidneys retain potassium instead of excreting it. Okay? If a patient is on spirulindactone and they are also taking a potassium supplement, that's a problemo. Why do y'all think that's a problemo? Because of what? What can happen if they are being spared and they're not getting rid of anything and they're on a potassium-sparing diuretic? Drop the word in the chat for me. Come on, y'all. Interact with me. Interact with me, please. Hyperkalemia. Drop hyperkalemia in the chat. Lady J, that is exactly what. Thank you for critically thinking, my love. Hyperkalemia will cause an arrhythmia, and it could be deadly. So you want to make sure that we are not taking potassium, because maybe they switched from Lasix to aldactone, spirulindactone. Maybe the doctor forgot to DC the Lasix or the potassium supplement. You never know what it is. Okay, the potassium can go dangerously high. The NCLEX will give you a scenario where a patient is on spirulindactone and they're prescribed a supplement, potassium supplement. They ask you what to do. The answer: question the order, contact the provider. Also, spirulindactone can cause gynecomastia in men. Do y'all know what gynecomastia is? In boys, it gives them man boobies. Man cha-chas. Okay? It's not an allergic reaction. That is actually a side effect. Does everybody know the difference between side effects and adverse reactions? Because side effects are expected. Adverse reactions are not. That's kind of like a stable. There's 112 people looking in on the FYP. Everybody, my name is Coach Shay. I'm the R Influencer, and I am teaching test-taking strategies for the NCLEX. So come on in, all my nursing students. Come on in to the live and quit peeping in my window. All right? It is a side effect, not an adverse reaction. So it's actually an expected result. Breast tissue enlargement, it's a side effect. Critical, ding, ding, da-ding, ding, ding. Here we go again. Spirulindactone plus potassium supplements can cause hyperkalemia. You never give them together without close monitoring. This is a classic drug interaction question on the NCLEX. Diana, welcome in. Empowered Queen, thank you for reposting. Sweet Cheeks, welcome in. Lasix teaching, ding, ding, ding. Lasix at bedtime is no, no, no. You give it in the morning to the patient to prevent nocturia. That's the correct word. You said which two? What are you talking about, baby doll? Neek, which two? What are you talking about, honey? I'm sorry, I'm not understanding your question. Spirulindactone, you should not take with potassium because it causes a critically high potassium. You should question that order and notify the provider, and you should not give it. It has to be monitored closely, so you want to make sure the provider is aware before you give it. If you're giving those two together, they have to be monitored closely. Okay? Nocturia, if you take Lasix at nighttime, you're likely to have nocturia, which means frequent urination at nighttime. Okay? Take it in the morning. It's one of the most missed patient teaching questions on the NCLEX. Everybody put Lasix AM. Thank you for that follow. Lasix AM. Welcome in, Isabel. Take Lasix in the AM. Everybody put that in the chat. It's one of the most missed patient teachings. Put it in the chat. Put it in the chat. Thank you, C. Put it in the chat. Lasix AM. Lexi AM, that works for me. I know what you mean, Yolande. Thank you, baby. Thank you all for communicating. Okay? All right, we're moving on to the antibiotics. T. Marie, welcome in. Antibiotics. Thank you, Ladybird. Thank you, Keisha. You're okay, baby. Thank you, Nurse Tadoon. Lasix in the morning. Take your Lasix in the morning, in the morning. All right. These 4 antibiotic facts alone could save you 5 questions on the NCLEX. Are you listening? Denise, welcome in. Are you listening? If you're listening, put a 1 in the chat. Antibiotics. If you are listening, put a 1 in the chat. I'm going to focus on 4 categories that the NCLEX tests the most heavily on. Lindrella, welcome in, baby. I am going to give you the 4 that the NCLEX tests the 4 categories that the NCLEX tests the heaviest on. Aminoglycosides, vancomycin, Flagyl, and fluoroquinolones. Okay? Thank you for that heart, me sugar. Thank you for that go pop. Aminoglycosides like gentamicin, tobramycin, and amikacin. 2 words. Nephrotoxic and ototoxic. Nephrotoxic means your kidneys. Sexy Black, welcome in. Ototoxic means your ears. These drugs damage the kidneys and hearing. Before you give an aminoglycoside, check the BUN and creatinine. Monitor urine output and monitor your patient's hearing. Ask the patient about ringing in the ears or decreased hearing. The drug levels. Okay? Trough level is drawn right before the dose within 30 minutes before. A peak level is drawn 30 minutes after the dose is complete. The trough tells you if the drug is clearing the body properly. The peak tells you if the dose is high enough to be effective or therapeutic. If the trough is too high, the drug is accumulating and toxicity is building. So you have a peak and trough. Y'all know about that with vanc specifically, right? A peak and a trough. They're important. The trough tells you if the drug is clearing the body properly. The peak tells you if the dose is high enough to be therapeutic. If the trough is too high, the drug is building a toxic level in the body. Vancomycin is an IV antibiotic for serious gram-positive infections. MRSA, C. diff. 2 things on the NCLEX test. First, Red Man syndrome. Susan, welcome in. Red Man syndrome. If you infuse vancomycin too fast, the patient will get flushing. Okay? Redness, itching, and flushing on the face, neck, and upper body. So on your trunk and your face. This looks like an allergic reaction, but it's really not. Okay? It's not an allergic reaction. It's called Red Man syndrome. Okay? It is a rate, it's like a rate-related reaction. What do? If you cause somebody to get Red Man syndrome because you are infusing a drug too fast, how do you think you can fix the problem right now in the moment. What can you do? If the fast rate is causing it, what do? Slow it down? That's right, Yolande. Slow it down. Everybody put slow it down in the chat. You do not stop it. You do not give epinephrine. You slow it down. Vanc must be infused over at least 60 minutes. Okay? Vancomycin is also nephrotoxic. You have to monitor the trough levels and the creatinine. Okay? Flagyl. Are you guys good with Vanc? Drop a 1 in the chat if you're good. Drop a 2 if you need me to go over Vanc again. Because if not, I'm moving on to Flagyl. Lexi, welcome in. Guys, if you're new here, you can go to the LINK in my bio and you can get the class material for today. It is complimentary material. Deborah, thank you for that follow. I also have my full comprehensive review discounted for this live stream. I highly recommend it. It breaks the NCLEX strategy all the way down, and you won't need another nothing. It's a question bank and strategy workbook all in one. LINK in my bio. Flagyl is used for C. diff and anaerobic infections and protozoal infections like trichomonas. You don't want no trichomonas. Keep your legs closed. Chandra, I have it discounted. It's normally $149.99. Today I have it discounted for $49.99, and it will be. It got picked up by someone, so I only have control of it during the live stream. Okay, I have to put it back when I'm not on here. I wish I could go into the details, but I can't. But there are students in here that have gotten it. You can ask them. I highly recommend it. That's why I have it discounted for people, because I understand. I remember what it is like to be in school. It's way less than what it would cost you to repeat your test. And you don't have to buy anything else. It's a question bank. Okay? There you go. You see, Lady J? It's right. Okay? Yes, you can use Afterpay and things like that too. So if you don't have it all right now, you can use Afterpay. Clara, I think, is another one. Thanks for that follow, Mariposa. So you can make payments on it. I highly recommend it, y'all. I promise. I know that it sounds like I'm not trying to sell you something. I'm trying to help you pass your test. Okay? You need my review. Thank you, C. I'm excited too, because I can't wait for all y'all to pass and come back and be like, we passed. I'm like, yes! They're going to make Coach Shay proud. Can I do a story time on my nursing journey? Absolutely. Chandra, do you know me or something? Because you said you're so proud of me. I'm like, wait a minute. Yes, I can do a story time. But let me teach. I'll teach right now. But yes, absolutely, I will do a story time. I would love to share my story with you guys. Just know that I have been through a lot of trauma, including the loss of my daughter, child abuse, SA as a young child, and domestic violence. I have a story. I have a big story. And the reason that I'm a nurse today is because my baby sister, her father that abused me as a child, was doing drugs, and she was born with cerebral palsy. I have been a nurse since I was 9 years old. True story. Not licensed, but nursing my baby sister. But I would love to share my story with you guys. Yep. God absolutely restored me, Lady J. God, y'all, I'm here with you all right now doing this because God gave it to me. To God be the glory for everything. If it was not for God after the loss of my baby, I would not be sitting in front of you guys right now. Because I was in so much agony and so much pain. It's unreal. But to God be the glory. Amen. Hi, baby. Can you, Mommy's recording. What do you need my phone for?
Call Margo.
You can use a tablet. If it don't cut, it's in here.
Okay.
All right. I love you.
You too.
All right. Don't lose my pen. All right, guys. When am I going to do it? You said I'm made for this. Thank you. When am I going to do it? I don't know. Whenever you guys want to. I'm building the community. That's what we're doing now, Solution. Everybody, if you want to join the community of growing nurses and educating our youth, please get your daily heart me and continue to return. Okay? We are growing a community. I want to help nurses. I want to love on my young nurses. And I also want to teach you all that you don't have to be a slave to the time clock forever. Okay? I'll do it. Until the end of the live stream, Nurse to Do. Until the end of the live stream. When I get off the live, I have to put it back because I don't have control of it. I know it sounds silly, but it's kind of like I have a partnership and I have full control while I'm on live. I can discount it, not change it, if that makes sense. All right. We're moving on to Flagyl. It's used for C. diff, all right, and trichomonas. Yellow Girl, I highly recommend that you go to the link in my bio and get my comprehensive review. It teaches you how to answer questions, not memorize. I made that for whomever needs to pass a nursing test. Okay? My students in here that have gotten it, they will tell you it breaks it all the way down. Okay? So the link in my bio, there's complimentary information for this class. And then my comprehensive review, if you get that, you don't need to make any other purchases because that is all you need. Everything's included. Go, Chaser and Naomi. Welcome in. All right, y'all. I'll post a video to tell you all when I'm going to do story time. How about that? All right. Lintz, welcome in. Merlande, welcome in. All right. Here we go. Here we go. Flagyl, it's used for C. diff and trichomonas. Keep your legs closed. The one fact that is on almost every NCLEX exam, no alcohol during treatment. Flagyl plus ETOH is dangerous. You're welcome, Yellow Girl. Did you hear me? No ETOH. I'm not supposed to say that word, so that's why I'm doing that. Linda, welcome in. No ETOH while you're taking Flagyl. It's dangerous. All right? If you combine the two, it can cause a disulfiram-like reaction, which is severe nausea, vomiting, flushing, tachycardia, and hypotension. It feels like the worst hangover of your life. Don't do it. I've seen it. Don't do it. You're going to be sick. Sick is S-H-I-T. Okay? Times 10. The worst hangover times 10. All right? The NCLEX will give you a patient who had a beer the night after finishing their Flagyl. The answer is they should have waited 48 hours. Put 48 hours in the chat. You should not have any ETOH consumption for 48 hours after you finish your Flagyl. General NCLEX, welcome in. 48 hours after your Flagyl. Okay? No alcohol for 48 hours. Okay? It causes a metallic taste in your mouth as well. So you teach patients to expect that. Flagyl will cause a metallic-like taste in your mouth. All right. Your fluoroquinolones like Cipro,